I specifically decided to go into nursing from a young age. I knew that my desire to care for people was there, it was innate. Once I graduated as a nurse, I was able to work in women's health, and so I started down the journey of GYN surgery. I went on to labor and delivery, and then now fertility. And I feel like fertility has been there for me all along.
To do this job every day is extremely rewarding. It's not just that we work with things like we love, like science and microscopes and cells that grow and see them develop successfully. It's that reward when somebody, brings their baby up here and show us the result. We always make a joke and say, "I was your first babysitter." It's really amazing, and sometimes when you do it every day, you kind of forget about it. But then when you tell somebody what you actually do, they're like, "Wow, you make babies?" So then you're like, wow, I'm so privileged to be here, and I just am so advantaged that I got the opportunity to do this.
We reassure the patients and letting them know that they can call us and address their questions, concerns, or frustrations throughout this process at any point in time. There is always somebody available to talk to, whether that's over the phone, meeting with the physician, or again, a one-on-one sit down with a nurse to address any issues that may be going on throughout the process. We want to encourage them that they are not alone on this journey.
The lab is super important for embryo development. So we want to try and create an environment out of the body where we can grow embryos. It's called in vitro. That means out of the body. The quality of the air, first of all, is really important. And for that, we have a really well-developed HVAC system. We have several filters that the air gets filtered through. It's layers and layers of filters. It's carbon, permanganate, and also HEPA filters. So if you have any allergies, it's a great job. We breathe really clean air. The incubators that we use are always kept very clean, and we control the whole environment inside of the incubators with gas, carbon dioxide, and nitrogen. The humidity is as close as 100% as we can get it. If I was a patient and I had to pick a place to go in the Metroplex, I would definitely consider choosing DFW Fertility Associates because of many reasons. There is a lot of experience here. If we all work together every day, we have to make choices on decisions on what we need to do, and we always ask each other. There's always 2 or 3 opinions in those decision making, so you're getting the very best decision making on the process that you will be treated with. The lab is very well equipped. Our equipment is the state of the art. Dr. Chantilis, Dr. Gada, Dr. Lee, Dr. Thomas, and Dr. Lawrence, they're really, really amazing people. There is certainly a personality that will fit you if you want to choose physician personality, because I know that's really important to patients. It's a very delicate thing for them and very personal and sensitive. So that's a really important thing to patient, but the quality of treatment that you will get here is excellent.
The best thing about being a nurse in the fertility space is that goal, that success of the pregnancy. We are so happy to see our patients find out that they are now having a baby, and there's nothing more that we can ask for, knowing that we were successful as a team. I love being a nurse. This is my passion. I come to work every day, happy to give that news, happy to help somebody get started in the process. We can't ask for better patients. These patients become an extension of our families, and what more could somebody ask for than expanding their family with those great relationships with their patients. It means the world to us as nurses to help build someone's family. We are elated to give them that great news that they are now pregnant and start expanding their family with them. That's the time where we start building these relationships with our patients. They look to us as a part of their family as well. It feels amazing when at Christmas or at the holidays when they stop by to visit us with their little ones or send us those holiday cards. It just reiterates the success we've given them and the happiness that they have looked for.
I have a family myself, so helping other people building a family is fabulous. When you get to that stage in your life, when you make that decision to have a baby, you want it to work. I am so excited that women can go ahead and do what they want first, and then if things needs some help later on when they decide to have a baby, that's a great thing to do, is to help these women have it all.